In order to prepare a 7-year-old child for an IV start, I would start by introducing myself to the child and the parent, saying, "Hi, my name is Katie. I'm a child life specialist, and my job here at the hospital is to make sure you understand why you're here today and different procedures that might happen. The first being your IV start. So the doctors are saying you need an IV. What is an IV? It's a tiny little tube or straw that goes into your veins, either here in your wrist or in your arm, depending on where the doctor thinks it might be best. And that little straw is going to give you something to drink, some medicine maybe, just to help you feel better. So the IV goes into your veins, and then the medicine is able to transfer all over your body. Do you know what your veins are? Depending on the kid's response, say, correct, they're right here in your arm. You can see those tiny little blue lines. That's where that little straw is going to go. So in order to start, you have a really important job for me today. I need you to hold your arm still as best as you can so that the nurses can get the IV in and everything will be perfect for you. So to start the process, the nurse is going to tie a rubber band right around your arm up here. It's going to feel a little tight. It's like a big rubber band. Do you want to try putting it on this teddy bear or this little doll that I have here? So tie the rubber band on with the kid on the bear or on the doll, and say, we're looking for the best vein possible because it's going to get a little bit bigger so you can see them. Next, we're going to clean the area off because we don't want any germs going in, or we don't want any dirty bacteria going in. So we're going to use this little alcohol swab. It's like a cotton ball, and it might be a little bit cold. So we got to rub the area and clean it really, really good. So next is when we put the IV in, and some kids tell me it feels like a little poke or a little sting, but it is over quickly. So they're going to put it in, and it's a little bitty needle that's just going to poke really quick, and once that's in, the straw stays in, but the needle comes out. So it goes in like this and pulls out, and all you have left is the straw in your arm or in the teddy bear's arm. After that, when you make sure the straw doesn't fall out, right? Because that wouldn't work for us at all. So we're going to put a little bit of tape over it. Sometimes it's a Band-Aid, sometimes it's clear so you can still see your skin, but it's going to help hold it in place and make sure your medicine goes into your body the way the doctor wants it to. Do you have any questions? Answer the child's questions, and then say, you have a few options here. So if mom or dad want to hold you, or if you want mom or dad to hold you during the procedure, that is perfectly fine. Sometimes they can help keep your arm still, but also make sure you are comfortable during that procedure. Another option that you have, you can either watch it if you want, or you can play with some of the toys that I have here. That is up to you, so I'll let you decide. Do you want to watch it, or do you want to play with the book or the toy that I brought here for you? Depending on what the child answers, again, let them watch it and keep that arm still, or introduce the toys to them, whether it's an I Spy book, a iPad, toys, cars, trucks, puzzles, whatever it might be. Introduce the toys to the child then. Lastly, something that some kids tell me helps is if they take long, deep breaths and blow it out, like blowing bubbles. That makes the pain go away a little bit more for them, and it doesn't hurt as much. Sometimes they say some kids like counting and make it goes really fast. But any way that you think might help, we're going to try and get it done as quickly as possible. Do you have any more questions before the nurses or the doctors come in to start the procedure? I know it might be a little bit scary, but we're going to do our best to make it go quick and easy and as little pain as possible. Thank you.